Welcome to Evening Rounds, a podcast that takes you behind the scenes in medicine. Tonight, we're joined by Gabby Pina, a pediatric physician who finds joy in caring for children and inspiring them to reach for the best that life has to offer. If you like what you hear tonight, please subscribe. Gabby, welcome to Evening Rounds.
Thank you. That was very dramatic.
Mm-hmm.
You know, well, I'm nothing but dramatic around here, as Kelsey is my witness.
That's true.
But in all seriousness, you've been someone I wanted to have on a podcast for some time. Mm-hmm. And part of that reason is you do many amazing things, and we're going to touch on several of those, I hope, this evening. One of the things that always strikes me about people who are passionate about taking care of sick kids is there's something very unique about them. And why I say that is I remember during medical school, I was going through our pediatric rotations and I thought to myself, there's no way I can come and do this every day. It would literally tear my heart in pieces because so much of this is things that you can't really comprehend. They've done nothing to their body. They haven't smoked. They haven't chosen the wrong foods. They have, it's just like the innocent gets hit with this injury or this illness. And so someone like you who's very passionate about pediatrics and pediatric health, I have to ask, first off, where did that come from? And how do you have the intestinal fortitude to do it every day?
Yeah, that's a really great question. Thank you. I feel very blessed to be able to have the opportunity to take care of kids. I fell in love with medicine with my grandmother, and she had really bad stage dementia as a child. And my family is very tight-knit. My mom is one of 12 that all live fairly local. And so we took shifts to take care of her, and she had type 1 diabetes. So I learned really early on how to manage medications and insulin, but to also understand how life-saving medicine is. So I fell in love with the possibilities of medicine.
And how old were you when this happened?
6.
Oh my.
My grandmother died when I was 10. So we took care of her and eventually transferred her to a assisted living home when it became too unsafe to keep her at the home. But she only lasted about a couple months in assisted living before I think her spirit gave away. And so it showed me the possibilities of healthcare and the possibilities of medicine. And I fell in love with it then. As I did my rotations, I realized that I wanted to be a physician that always advocated for my patients. And I struggled on adult medicine doing that. Because a lot of that they did to themselves. And I didn't want to become that jaded, judgy, negative physician. I wanted to always believe there could be better. And I found with kids, I did. Even when they had horrible diagnoses or they came in because someone treated them poorly, they still had a possibility to have a better life. And so I could fight for that. And I could work with that. And so I was able to get through each day knowing that tomorrow could be better.
That's so incredible. How does that translate in the day-to-day for you?
It's my fuel. I have 2 boys, and they are both very different and both a big part of my soul. My oldest is my stepson that I adopted from my previous marriage. I say that like a book title because it explains a little bit of my personal growth and our growth as a family. And so I learned a lot about childhood trauma by raising a kid that wasn't biologically mine. I fell in love with that kid when he was 5, and I've loved him every day since. And we've been through some rough stuff. He's had a lot of abandonment, which manifests as anger and a reticence to accept love. And so I see him in a lot of the kids that I take care of.
Wow. What a way to look at all these different interactions I'm sure you have during the day.
Yeah. It's been, I say parenting has actually been the best form of physician education for me.
Why is that?
So you know how they say only have kids when you're ready to see the worst forms of yourself?
Yeah.
My youngest is very much the spitting image of me, which makes it real hard to parent because the same things that I annoyed my parents with are super annoying to me. The same quick comebacks that I'm very proud of in a conversation, he comes back even harder.
Wow.
And so you try really hard not to laugh or pull your hair out, but then your kid gets sick. So my son, my youngest had, right in the middle of COVID, he had gotten COVID. And about a month later, he started spiking fevers with like a full body rash. It was super concerning. It was really early for MISC, so multi-inflammatory systemic complex. Now, granted, end of story, he didn't actually have it, but the fear I had traveling with my kid to the ER with this new horrible complication of COVID where he was febrile up to 104 and vomiting and had to be hospitalized. You know, and that's just an overnight stay in the hospital for an otherwise healthy kid. And so that made me really pause. These parents of chronic kids.
Yeah.
I can't imagine.
Yeah.
So much to carry.
So when they ask me for the 8th time if I'm sure I've checked the ear right,
Yeah.
totally okay with it.
Wow. What a beautiful way.
They're not questioning your competence.
Yeah.
They are very concerned about the well-being of their child.
Correct.
Which you felt. I feel like you've mentioned before, you're from Moreno Valley.
Born and raised.
And so you chose to serve here and to be here in this community. What has that been like?
Oh, it's been exceptional. I feel very connected to the patients that I serve because I feel like, oh, I went to that high school.
Nice.
Yeah, I graduated in 06. And I have a few patients when I did clinic regularly who were like, no way, you're from here? And I'm like, yeah. And you're a doctor? Yeah. And I think it models possibilities.
Yeah.
And more than anything, that's the coolest part of my job.
Yeah, definitely.
You've not only modeled what possibility looks like, you've really done a lot of, I think, very creative and unique leadership programs here to inspire. And I wanted to hear more about that. You do a DIME program here on campus, which I'll let you say what the acronym is, but I think it's beautiful. And I'd like to hear you talk a little bit more about what your view is on your role in inspiring people to come behind you.
Yeah, DIME has been the most exceptional piece of my post-residency life. Outside of now being a residency track director, it's been formative to my growth into who I am as a person and the connections that I serve, really fulfilling a purpose. So DIME stands for Diversify, Include, Mentor, and Educate, and was birthed during the beginning of COVID between a conversation with Dr. Akua Kobana and myself. And we approached Papa Chenik. I'm sorry, Dr. Richard Chenik. He is Papa Chenik for me now and forever, and he knows
love
it.
that.
He was a guest here last year.
I know. He's an exceptional human. And so we approached him and feeling the angst of the community that we were serving and the angst of the faculty, we had to do something. We were talking about nothing during COVID in the beginning. It was like everyone was afraid to say something wrong. And so the silence was deafening. So when we approached Papa Chenik, we said, hey, like our community needs this, our faculty need this. We need something to unify us, to be connected to the community that we serve. And he was like, let me simmer over this. Because, you know, Papa Chenik, he's not unintentional. He is incredibly intentional and thoughtful. And he wanted to give it the time and space that it deserved. So he came back a couple weeks later and was like, all right, let's do this. And he created 2 groups. DIME is the group that Dr. Althea Daniels and I ran for a while. And then the other group is DEI, which is now ran by Dr. Ariane Marie Mitchell and Dr. Akua Kobana. Their focus is on quality improvement and how do we improve patient care with a DEI lens. The DIME's purpose is how do we change the culture? How do we change the conversation?
Yeah.
How do we change the education? And so we started in COVID, which meant we started not in person, all virtual. So we went to social media. We created a lot of Instagram posts highlighting the specific unique Heritage Month, special celebrations, highlighting and spotlighting individuals who are unique in a variety of different ways within our pediatric division. And then we incorporated education into our grand rounds and a virtual platform, which was able to reach to 250 people at one point. We then started looking at the residents and being like, what can we provide you with? We've sent out surveys and got their feedback. started regularly teaching about microaggressions and implicit bias and having those really awkward and uncomfortable conversations.
Yeah.
And it's grown to include things like pathway programs, mobile health units, the patient health advocacy conference that we do with Dr. Ariane Marie Mitchell and Akua Kobana. So it's been a wild ride that I am so happy to be a part of, and I'm really looking forward to the future.
Tell us a little bit about that pathway program and kind of what that is and what you've seen from that.
Yeah, I am so pumped about this pathway program. And I cannot do it justice if I don't mention the people who started this conversation. So Dr. Jasmine Fernandez and Dr. Marcus Lowe are now third-year residents in our primary care track program. And part of our primary care track program has to do with scholarly activity. It could be anything from curriculum development to research to quality improvement. They looked around the community and said, I want to do a pathway program. How do we do a pathway program here? We happen to be very well connected with Riverside University Health System. And the family medicine program has a program called HELP, Healthy Eating and Living Promotion, which teaches high schoolers in the healthcare academy about all things healthcare. They do a wonderful job. But we thought that's too late. By the time they get to high school, they've decided kind of the personality they want to be, the friends they're going to hang out with. We need to get them earlier. So I told you my kid, my oldest, had some struggle buses in middle school, which meant that the principal and I were real good friends. Principal, vice principal, security guard, his teachers, which turned out to be quite a blessing.
Wow.
So then when I met with the principal, she said, hey, I've got this really great science teacher. Her name is Miss Blask. She teaches anatomy and physiology. She's super passionate about it. I was like, I should meet her.
I love that.
She was like, yeah, you should.
Oh, how cool.
So we connected, started this conversation and said, let's do this. Let's just go for it and see what happens. And over the past year, we've been able to educate 52 middle schoolers regularly, once a month in their classroom. This past April, we brought them to Riverside University Health System, and they did a half-day immersion where they heard from a panel of physicians, nurses, respiratory therapists, healthcare providers, and did a tour, which their highlight was the morgue, because these kids are special, let me tell you. And then we got to award 33 of them with white coats at their 8th grade graduation ceremony. And the next day when they promoted, they wore their white coats as they walked across the stage.
I mean, when you think
That's
about
incredible.
how impactful
cool.
and the ripple impact of that and the families and all the different, I mean, that has got to make you so proud.
Yeah, it's pretty, like we all were like shedding tears.
So where does that vision come from?
Well, my mom is foremost the most amazing person in my entire life. But she was also one of the people who shaped me quite early in life. She kept me real busy. If you've met my 7-year-old, you've met me as a child. I asked a lot of questions. I talked all the time, and I didn't really take no for an answer, which meant my mom, who worked as a correction officer for Chino Men's Prison, and my dad, who was a shoe manager for Kmart, when they were working full-time jobs, I got a little much. I was a little busy. So they put me in a lot of programs early on. So I started doing STEM stuff when I was in middle school, actually probably around 5th grade. She started putting me in Saturday school that would talk about robotics and engineering, literally to keep me out of her hair.
Brilliant.
I did a lot of summer programming that included, like at UCR, there was a lot of local summer programming to do sports and learn about science and healthcare. And so she kept me active and busy, which feels very much like a homemade pathway program. As I got older, the stuff she put me in streamed more and more towards science. And so by the time I got to college, I had experienced a whole realm of opportunities in science and was dead set on medicine. And so I think a lot of my love and passion for pathway programming comes from my mom, who was very intentional with her actions with me. And not every kid in my community is going to have a mom who's able to do that, or a dad who's able to do that, or a foster parent who's able to do that. So if we can build it in and give them the option to do that without having to go anywhere, why not?
Yeah, it sounds like you're becoming kind of the community's mom a little bit. Like what she modeled for you, you're kind of trying to do for them. I saw some incredible quote that said, my mom clapped so loud for me that I never noticed others that didn't. Mm-hmm. And I feel like it seems like you're really trying to uplift so many people in the same way she uplifted you.
Yeah, I look back and, I feel like I was real dumb in my early 20s. I don't know if any of you guys were.
I certify I was
I'm sure
as
you
well.
were brilliant, I'm sure.
You were brilliant, right, Dr. Hilliard?
But I was...
We're just going to say no comment on
we're
that one.
It's safer for all of us.
It wasn't until, life happened and I had kids that I really appreciated the foundation that my parents set together. Whereas my mom was the one who was like, you need to study, you need to go to school, academics are important. My dad was like, let's go have fun. Let's go play in the park. And that balance was really important. Yeah, that balance was really important for shaping me. And so there's a lot of kids who don't have the privilege of having a 2-parent household.
Yeah.
Or like emotionally and mentally present 2-parent household. And again, as I'm experiencing life through the lens of a blended family, I'm learning a lot about how childhood trauma manifests into doubt and insecurity and really hinders the possibilities for kids. And so if I can create something that doesn't necessarily negate the fact that they're not going home to a stable household, but that gives them maybe a goal or a chance to create a stable household for themselves in the future or fulfill their purpose, that's the best thing in the world.
Yeah.
That does sound like the Moreno Valley mom to some extent.
Yeah.
That's an awesome responsibility. Incredible, actually. There's a saying that kids say the darndest things. And a question I have for you, in your day, what are the sorts of things that kids say that put a smile on your face?
Oh, I had a really, really great interaction a few months ago when I was on service. I went to the PICU there's a downgraded for like a 3-year-old with asthma. And I went into the room to introduce myself, like, hey, I'm Dr. Pina. I'm going to be your attending physician when you come over to the wards. And the mom was super nice and we were talking. And I hear the little girl whisper, is she my doctor? And the mom just nods and she goes, she's so pretty.
Oh, I love that.
I mean, it's not too often that a 3-year-old is fangirling a little.
And they are very truthful as someone who lives with
honest.
one. Honest.
So honest.
Yes.
And so I go to her and I go, thank you so much. That was really nice. And she goes, you're a doctor? And I go, yeah, and you could be too. And she goes, I can?
Oh.
And I said, yeah, you could do whatever you want. And so then I saw her the next day and was able to discharge her. And her mom said all she did was like cling to that yellow stethoscope and like took it home with her. And so I think just the honesty of children, but also the ability that like one interaction can change their perspective.
Yeah, you seem like someone who just gets kids. Like, I feel like you could carry on a conversation. Like, most of us would probably be terrified to talk to a 13-year-old. We'd be like, what do I say? How do I connect with them? And it just feels like you have the energy, the right energy to be able to do that with like a child of any age.
I actually do quite well with teenagers.
Yes.
Mostly because I'm a straight shooter. When they try to pull their shenanigans, I go, no, we're not going to do that. We're not going to do that.
Yeah.
Yeah, you came here for a reason and I'm here for a reason. So how about we be honest with each other? Does that sound good? And then most of the time they are, actually.
Yeah.
And so I've always had like a strong passion for teenagers. I think they're a population that's very misunderstood and judged very quickly. And so even when I was in college, I would volunteer at a youth detention center.
Wow.
Well, because these are the kids that I think just didn't get the love that they needed. And so it's not, some of them it's their fault. Some of them they made some very questionable decisions. And you got to be honest.
What'd you do when you were there?
I would have really good conversations and we would play basketball, played a lot of sports, formed really good, just initially very surface levels because, you know, they're very guarded.
Yeah.
But I found their interest. So I hung out with the girls' camp and we would make bracelets and color. These kids were like in their teenagers, but they didn't have much of a childhood. So there are things that they like to do or now childlike things.
Yeah.
Yeah.
And so as we're making bracelets, I would ask, so how's life? Talk to me. And initially it'd be, what do you want to know about? Why you want to talk to me? You know, pretty normal teenage stuff. But I went there for 3 years.
Wow.
Pretty regularly. And so over that time, I got to see them leave Some of them come back, but open up and have really good conversations. And so, yeah, teenagers are pretty awesome until you have one, and then you want to poke your eyeballs out regularly.
I'm not ready for it. It sounds like a hard job. I do feel like, though, I remember as a teenager, like going to the doctor and that being a very scary thing. And it being very intimidating. And I never wanted to ask that older white man, forgive me, questions.
The older part is not applicable.
You don't. It's really hard as a teenage girl to open up about probably some of the things or questions you have. And so that's really incredible that you can give them that space.
So Gabby, your positivity and energy for life is infectious. And the question I have is, I mean, you are fortunate to have found a job where it's a job, but there's a lot of wonderful rewards that come from it and a lot of meaningful interactions, it sounds like. What I'm trying to understand is, could Gabby have the same amount of passion and joy pulling weeds in a garden because of who you are, or is it the work that you do that brings you the passion?
Yeah.
Ooh, that's a good question. I don't think weeds would bring me much joy.
How about being a CPA?
Are you sure?
Oh, numbers. Okay. I think I was created for this job.
Okay.
The only other job that I considered in the middle of college was actually social work, which is kind of what pediatricians do anyways.
Yeah.
We do a little bit of case management, a little bit of social work, a little bit of therapist and counselor. And so I think I was specifically created to do this work. And it does bring me a lot of joy. Yeah, I feel very lucky to have found the thing that brings me joy.
Which is a lot of good career advice for people who are listening to this podcast, right?
Yeah.
Don't do what other people think you should do.
Yeah.
Follow your heart.
Yeah, my mom was pretty disappointed when I picked pediatrics. She was like, that's like the lowest paid specialty. And I was like, yeah, but that's not really why I did this. Like, it's not. I talk to med students all the time. And same with PA students and all learners is you have to do what brings you joy. So pediatric medicine itself is fascinating. The idea that something can come from an embryo, develop a spine that then hardens as they grow, then they go through puberty and turn into a grown person, and you get to be a part of each stage of that. Wild. The changes in pathophysiology, the like different demands on the metabolic system. It's the coolest thing.
It's a miracle, isn't it?
It's such a miracle.
So unreal. I've never heard it like laid out like that, but you're so right.
I mean, the thing about it is, right, how many millions of things happen.
Yeah.
And my goodness, like most of the time, it gets it done right, which is phenomenal.
Wild.
Yeah.
Right? And then to watch them develop into the person that they're becoming. So not only are they growing physically and cells are morphing and changing, but they are figuring out who they are. That is cool. Their first words to their first paragraphs to their first mustache. Like it's just...
Don't you think some of the teenage... This is coming from an ill-informed expert level sort of analysis.
Oh, good. That's not a new rating system?
Yeah, it's really not very high up there on the rating scale. But to me, it seems like some of teenage years is trying on different things.
Yeah.
How does Anthony look doing things like this? Or how do I look doing things like this? Right? You just, and I've always thought, they're pushing your buttons or pushing my, but I actually think they're trying on things for themselves. How does this one fit? Do I like jeans? Do I like corduroy pants? Do I like shorts? It's interesting, right? To watch the little neurons sort of make those connections. And
As someone who has recently reflected on some of my high school clothing choices, I will say I should not have tried on some of those outfits.
I think we can all say that. But it's you mentioned it before. That's a big responsibility for a parent, for a caregiver, for a neighbor, a mentor, a friend, is that we are helping them inform some of those things they're trying on.
Yeah.
And that's scary when I think about my patient's level or when I think about, how I want to protect or shape or form. And that's an incredible responsibility.
Yeah. And I think if we think about it like that, then we won't be so casual with our words. Yeah. Because they say sticks and stones won't break your bones, but words will never hurt you. But those are the ones that last forever.
100%.
Oh, yeah.
We've talked a lot about what you've done in the community, and I think that's extraordinarily profound, the Moreno Valley mom. I don't want to label that because I think that's probably underestimates the profound impact that you have in your community. One of the things I always want to ask our guests is, we were intentional about the title Evening Rounds. I would like to hear from you, when you hear the term evening rounds versus morning rounds or working rounds, or you name the other terms that we use as we practice hospital-based medicine. But evening rounds, when you think of that, what does it mean to you?
So for me, the only true evening rounds I ever experienced in residency was in the ICU. And so we would do evening or night rounds. And those were one of my favorite rounds. It was a smaller group, very intimate. It was almost the calm before the storm, typically. It's that lull between the busyness of the work shift of the day and the chaos that the night was going to ensue. So it felt like a little breath of fresh air. And so for me, evening rounds is a time to sit, reset, and get ready, but also to appreciate what's been done and what needs to be done.
How do you do that in your very busy life?
Ooh, girl. I was just thinking about that on the stairs up here. I was like, I need Jesus. So I am working intentionally with my therapist to create better boundaries because I take my work home with me all the time.
Yeah, I can only imagine.
Emotionally, but also physically, because I want to be as available to my residents as they need me to be, because I never want them to feel floundered. I recently got married last year.
Congrats.
Yeah, he's pretty awesome. I really like him a lot. And it came with a beautiful bonus daughter and another blended family. So I'm learning a lot about what I thought my expectations were for my life and how beautiful, much more beautiful it actually is. And so I want to prioritize my marriage. And so I'm intentional with time with him. And I'm intentional with time with my kids to make sure that they feel seen and valued, but they also understand that mommy has to go to work. And not just to pay the bills, but because it makes mommy so happy. And then my parents are aging. And I know when that time comes for them to pass, I want to make sure I can look back and say, I spent some really great years with them.
Yeah.
And I really valued them, and they felt loved. They weren't just parents to me, they were friends. And so I try to carve out time for each one of those people. And then I have time for myself.
Yeah.
But they bring me so much joy that I'm okay taking the back burner for a little bit because they matter that much.
It's a beautiful evening rounds.
And everybody says amen.
Yeah, absolutely. You got me on that one a little bit.
I was trying not to cry.
I know.
It didn't work. Well, Gabby, that was awesome. I mean, what a wonderful way to spend my evening. I know others are going to feel the same when they hear this. I thank you for what you're doing, what you've done, what you're going to do. It's really appreciative, and yeah, you're awesome.
Absolutely.
Thank you, guys.
Unstoppable.
A special thanks to the sponsor of Evening Rounds, La Loma, who has provided banking services to the Loma Linda community since 1955. Their support helps us continue bringing you episodes focused on health, story, and mission.